everyone, I'm Dr. Swagtesh Bastia, Director and Co-founder at Alleviate, a center of pain management, spine care and regenerative medicine. Today we are going to talk about a very interesting yet very essential topic that's called chronic pain generators in the lower back. Chronic low back pain is a chronic pain syndrome in the lower back persisting for more than 3 months. It is a major cause of disability worldwide and is a major economic and welfare concern. Its prevalence in the adult population has more than doubled in the last decade, and it has had a significantly adverse impact in the occupational activities and the functional status of people. It is also associated with psychological factors such as stress, anxiety, and depression. Given this complexity, the diagnostic evaluation of chronic low back pain can be quite challenging, and hence it requires careful clinical decision making to arrive at a proper diagnosis. Coming first to discogenic pain. This is probably the most commonest cause of chronic low back pain, and I will try to explain it to you with the help of this diagram. So this is essentially the diagram of a disc, and inside is a jelly-like nucleus pulposus, and outside it is bounded by structure known as annulus fibrosus. So what happens in disc herniation is, you can see slowly the nucleus starts protruding from its normal position and it starts migrating outwards. So when it is migrating out, this area that is migrating out has increased vascularity and nerve innervation, which is the reason for increased pain. Now in discogenic pain, the pain is generally midline or axial in location. Radicular pain is pain in the lower back radiating down to the buttocks, lower thighs, and even goes down to the foot. Radicular pain happens due to the disc migration or disc herniation. I will show you on this model. Here you can see this red part of the disc jutting out indicates a disc herniation. So in radicular pain, it is more commonly due to inflammation of the nerve root than actual compression of the nerve root by the extruded disc. It is very essential to do an MRI, and it is a correlation between the clinical findings and the MRI which helps us to come to a diagnosis. Spinal stenosis is essentially narrowing of the central canal or the lateral recess, leading to compression of the spinal cord and its associated neurovascular structures. Now this can happen due to hypertrophy of the ligament, or due to hypertrophy of the articular processes, due to previous scars from previous surgeries. All this can lead to narrowing of the central canal and lead to spinal stenosis. A patient classically presents with neurogenic claudication, they have altered sensation, and sometimes they have motor weakness as well in the lower limbs. The patient has a lot of pain on extension and on standing for long time. They feel much better on forward bending or stooping forward. This is also known as the shopping cart sign. Now I'll explain that with the help of this model. Facet joints are basically joints which help the bones in the back articulate with each other at every level. You can see here, these are the facet joints. Like any other weight-bearing joints in the body, these also undergo arthritis. Facet joint pain comprises of 30% of all low back pain. The patient typically complains of pain near the midline, which does not radiate beyond the buttocks. It is aggravated by extension. Now, in facet joint pain, the pain normally emanates from either the synovial membrane, the hyaline cartilage, the arthritic bony surfaces, or the fibrous capsule. Now, let me show you with the help of this model. The sacroiliac joint essentially connects the spine to the pelvis, and it is represented by these two lines on either side and extending all the way behind as well. So the sacroiliac joint does not allow a lot of movement, hence it contributes greatly to the stability. There are large shear forces acting across this sacroiliac joint, which can lead to sacroiliac joint disease and pain. The patient typically presents with pain in the posterior superior iliac spine, and it generally doesn't go down all the way like true sciatica, but it can radiate a little way down. Then it is aggravated by sitting for long, and patients also experience difficulty in sleeping in one position for long or sitting in one position for long. In sacroiliac joint disease, the pain generally is emanated from the capsular distension or the inflamed ligaments or the arthritic bony surfaces. In piriformis syndrome, what happens is the sciatic nerve, as it passes through the belly of the muscle, can get irritated or compressed due to repetitive spasm of the muscle. Now this leads to pain in the buttocks or gluteal region specifically, and sciatica-like symptoms without low back pain. Trigger points are myofascial pain, fractures, then thickening and inflammation of the anterior longitudinal ligament, posterior longitudinal ligament, or the interspinous ligaments. If you or your loved ones are suffering from chronic low back pain, please feel free to go to any of our centers and get consulted by one of our specialists.